Welcome to the Why Did I Get Cancer podcast. I'm Deborah Herlax-Enos, a small-town girl turned TV nutritionist and healthy living expert. I design health programs for the average guy or gal, including those average guys named Metallica. On September 1st, 2020, I was diagnosed with breast cancer. I asked every oncologist the same question, why did I get cancer? But none of my doctors had good answers for me. I wanted answers, and that's why I started this podcast. I want to help you to lower your cancer risk and provide self-care tips for those in the battle. I'm getting answers, and I want to share them with you. I had so many great takeaways with Dr. Laura James. First of all, she calls estrogen a happy drug, which I can totally agree on because when my happy drug went away, I wasn't so happy anymore. But she also says too much estrogen can be problematic and we can have too much of a good thing. So she really cautions us about being careful about xenoestrogens. Hard to say. Xenoestrogens are estrogens that come from the environment. So it might be the air we breathe, or a simple one to change, quit microwaving in plastic and stop using so much plastic because that's a xenoestrogen and that can disrupt your hormones. She also tells us that estrogen may not cause cancer. She did say the jury is still out, but it certainly can encourage the growth of breast cancer. Listen to today's episode to get all of her amazing, eye-opening tips about breast cancer and estrogen. I'm so excited for this podcast. So this is my naturopathic oncologist, Dr. Laura James, and I got to tell you, I definitely went the full Western route with breast cancer, and I wish I would have met her sooner. I think I would have maybe done a few things differently. So welcome, Dr. James. How's that for an intro?
Thank you. That's a great intro. I'm so happy to be here. Thanks for inviting me, Deborah.
Yes, you really helped me, and I met you probably I was probably 80% through my breast cancer journey when I met you, and I say maybe I would have done things differently. Who knows? When you hear the C word, you do what you got to do. But can you tell us what a day in the life of a naturopathic oncologist looks like?
Sure. So there is a difference between a naturopathic doctor and naturopathic oncologist only in that the patients that we treat are a little bit different. We're still coming at overall health from a holistic perspective. But those of us who've gone the extra mile to become naturopathic oncologists, we are entirely focused on helping patients with cancer from a holistic perspective. And the majority of us really do practice an integrative model. So helping patients do both the conventional care and integrative care so that their outcomes overall are going to be better. Day to day, mostly I see women with breast cancer. I would say 85% of my practice is women with breast cancer, but I do see adults with other patients, and my clinical practice really is like any common private practice would be. So one-to-one patient care.
Well, I just felt like talking to you was such a godsend because, and of course, I'm coming from cancer from a certified nutritionist perspective. And I wanted to do things as naturally as possible. And I did and I didn't. So can you tell me, when it comes to breast cancer, I think the biggest shock for me was I had to give up all my hormones. And I was on hormones for a little while. So once that happened, I went into immediate menopause. That was a real struggle. Can you tell us, why do women have to give up their hormones at that point?
Yeah, so that's a very good question. It's a very difficult question to answer because we have some science, we don't have all the science. That abrupt shift when you have been on some kind of hormone replacement therapy and you're diagnosed with breast cancer and you have to come off right away, that's an awful feeling. And it leads to, in many cases, a really difficult quality of life kind of experience, right? Mm-hmm. Women can have that experience even if they don't have breast cancer, whether it's they're on hormone replacement and they go off for some reason, or they just become menopausal. And that kind of shift can happen. You go from sort of 100% of your hormone levels to like 1% of your hormone levels. And part of that reason is because we have estrogen receptors all over our bodies, not just in the breast, not just in the ovaries, not just on the uterus. We have them all over. And so estrogen, in many ways, really is kind of the happy drug for women, even though we can have problems with it, right? We can have too much of a good thing, and that can cause problems in a different realm. So, the standard of care for women who are going through breast cancer treatment, if they have an estrogen receptor positive breast cancer, which is 70% of the women who are diagnosed with breast cancer, they'll have they'll have estrogen receptor and progesterone receptor positivity. The recommendation is don't give any estrogen. If you're taking hormone replacement therapy, go off. If you're using herbs that could be estrogenic, go off. Certainly, from my perspective, I want to encourage people to stop doing things like microwaving with plastic, because there are xenoestrogens, estrogens from the outside, foreign estrogens that might be getting into the system. So there's some environmental recommendations that can be made as well to reduce estrogen burden. We think estrogen encourages the growth of breast cancer. The jury's kind of out on whether or not it causes breast cancer. But the encouragement of breast cancer is what we think is happening. And so that's why we have this whole course of treatment for women with ER-positive breast cancer to decrease the amount of estrogen in their system.
That's such an interesting point, that environmentally, we can also start to lower xenoestrogens, which is just, again, as you said, another form of kind of this outside estrogen that we're introducing. And that's something I hadn't really heard in my breast cancer journey until I talked to you, of course.
Right. And it's not necessarily something you're going to talk about with your conventional oncologist. Mm-hmm. There are certainly quite a lot of things in our environments, in our, I should say, modern environments, that are going to be estrogen disruptors, is what we call it. People might be more familiar, well, people are certainly familiar with plastics. And plastics, up until only a few years ago, were full of something called BPA, right?
Mm-hmm, right.
And BPA is now, you'll see if you buy something new that's plastic, that's like a Camelback water bottle or something like that, it'll have a little thing on it that says BPA free. Right. And that BPA is, it's bisphosphoacetate, I think is what the acronym is for, is an estrogen disruptor. And it's one of many estrogen disruptors that we find in plastics, in processed foods, in the way our non-processed foods are handled. For example, conventionally produced beef, right? So, or dairy products, things that have hormones and hormone-like products introduced into them. And you as a nutritionist, I know a lot about this. But there's a lot that particularly the American woman is exposed to in just day-to-day living that could be influencing both hormones and the way the female body handles hormones, and then pollutants as well, right?
Right. So what we're breathing, what we're drinking.
Right.
Lotions, I would imagine, too. Lotions and potions that we're putting on our face and our body.
Exactly. Right.
Okay.
Yeah.
So you said American women. Have you seen any research from other countries where maybe there's not such a heavy emphasis on plastics, where could there be lower breast cancer rates in other countries?
There are lower breast cancer rates in other countries, but most of the data that I've seen related to lower breast cancer rates have more to do with diet. And there may be information out there about other environmental things. Certainly lots of other countries where there, may be a lower rate of breast cancer still might have higher levels of pollution for whatever reason. But, if you look at some of the studies on Japanese women who have a lot of soy in their diet, and soy has been, sort of a controversial topic for a long time. It's not in my book. I think women should eat soy. But soy and fish and fresh vegetables, that's a very different diet for a Japanese woman than the kind of diet we have here in the US, right? Your average woman.
So
right?
True.
So
true.
I've seen much, much more data regarding nutritional interventions or just lifestyle and culture and lower breast cancer rates. But there may be higher rates of other cancers.
Right. Okay.
Right.
So you just mentioned soy, which is, of course, I hear it all the time. You still eat soy? People say to me when they see me eating edamame, which I love edamame. It's soybean pods. It's super high protein, high fiber. It's, I love them as a snack. So is soy not in jail anymore when it comes to breast cancer?
It depends on who you talk to. And you asked me about, a day in the life of a naturopathic oncologist. A lot of what we do in naturopathic oncology is try and think outside the box, right? And so if you talk to a lot of conventional providers who may have been trained in the 1980s or early 1990s, even late 1990s, early 2000s, they might still be advising patients that soy is not okay to eat because they think that it will cause estrogen levels to go up. Soy indeed is a phytoestrogen. It is a plant-based estrogen, and there are quite a few foods that are phytoestrogens, quite a few plants. But there have been, in the last 10 years, I would say, some meta-analyses done looking at all the data around soy, and soy is actually breast protective. And my understanding is that it's breast protective because it takes up space in the estrogen receptor so that stronger forms of estrogen that would be naturally occurring, like estradiol is our strongest form of estrogen, won't sit in that estrogen receptor and cause stimulation of breast tissue. Soy can sit in that same estrogen receptor because it's a lock and key model. And so soy has a very similar looking key for that lock. And it stimulates a little, but not as much, right? So soy actually works the same way that tamoxifen does. Tamoxifen, a drug used post-active breast cancer treatment, is a selective estrogen receptor modulator. So that sits in the estrogen receptor and modulates it. Soy acts very similarly. Soy is a SERM. And so I recommend that women eat soy because, based on the data, it does add a level of protection.
That is so fascinating. Fascinating.
There's also some evidence that young women who eat a lot of soy in their diets experience that breast protection starting from a young age.
Really?
So what I tell my women who have daughters is feed them tofu and edamame.
I see that you didn't say soy milk or tofurkey.
Well, I think soy milk is okay. Tofurkey, I'm really not sure what that is.
I've been in this field for 30 years and I've, had all different kinds of diets that I tried. And I remember when I was, probably 25, young and dumb, and I was eating everything soy. So I'd have, 2 or 3 soy milk lattes a day. It was Thanksgiving, so I made a tofurkey out of, all this super processed tofu. And my family would, put me at the kids' table. They didn't even want me to eat with them because I was so obnoxious. But that's what I'm saying. Like, I think there's, from the data I've read, is that there's, your natural soy, meaning it's edamame, it's tempeh, it's tofu, and then we've taken it and we've processed the living heck out of it and turned it into a fake hot dog.
Correct. And, Deborah, when you and I were 25, we're roughly the same age. When you and I were 25, there wasn't much else out there besides soy milk. Like that was the alternative, right? And so really true. I think soy milk is that borderline product. I always recommend for people who will eat soy to eat whole soy. So tofu, tempeh, edamame. The fermented soy actually does have good research behind it as being protective. Not everybody likes that flavor. But the processed soy, and particularly, you probably know this as well as I do, but soybean growth, particularly GMO soy in the Midwest, is a big cash crop, right? And that soy protein is used in lots of different places. And some of those places are in the processed food supply that our women are exposed to. And so women may be inadvertently eating high levels of GMO soy protein that they really shouldn't necessarily be getting. And in that context, it may not be breast protective. It may be breast harmful as well as thyroid harmful.
Oh, interesting.
Because soy can also affect the thyroid gland. But, this is an example of you got to read the labels, and you want to be shooting for foods that if they have a label, meaning it's not just like a whole apple, it has 5 ingredients or less, right? So, but all of that processed soy, that's not going to be doing anybody any good.
Not any good. So you bring up labels, and I invite you to jump in on this, and if it's not your area, that's fine. But can we trust labels? I have a good friend who's battling breast cancer right now, and she's going to need to be really careful moving forward. So how do you, can she trust a label if it says, non-GMO soy?
My understanding is that there are some very tightly regulated definitions in terms of USDA regulations. So organic is very tightly regulated and very hard for someone to get. I believe non-GMO is also tightly regulated. The things that aren't tightly regulated are terms like all natural, right? Like that's a load of BS. It's a load of BS. So I believe non-GMO is, but somebody prove me wrong.
So we're going to get down into some nitty gritty here and talk about, I'll just talk about my experience, and then I want you to just dive into the deep end with me, Dr. James. So I got diagnosed with breast cancer on September 1st, 2020. By September 2nd, 2020, I was off all hormones. And by September 3rd of 2020, I was no longer sleeping and sex was painful.
And I think that's about where I met you. or close in there.
Probably.
So going back to what I said at the beginning about the fact that the female body thrives with estrogen, having that switch turned off is brutal. And you know it from firsthand experience.
Brutal.
I know it from lots of clinical experience. It is brutal, and it is an unfortunate situation for women who have to go there. The brain most likely needs estrogen. The tissue needs estrogen. I mean, all of your tissue. Certainly all of your reproductive tissues, the vaginal tissue, all of that needs estrogen, and the bladder needs estrogen. You think of your bladder as being think of it as like a balloon that has a triangle on it. That triangle is called the trigone muscle. And that muscle is what controls your bladder size, really. and it has estrogen receptors on it.
Oh,
so
okay.
a lot of women who go through what you did also have urinary incontinence. They're starting to leak a little bit of urine out in public, or, cough, sneeze, whatever. Boom, there's, wet underwear, which is uncomfortable for women, certainly.
Of course, yeah.
Right. So,
and is there also risk of increased urinary tract infections as well?
Mm-hmm.
Okay.
Yeah, and it's because the whole urinary tract becomes like this, the tissue becomes thinner. That's what happens. That's what happens in the with the vaginal tissue, is it starts to atrophy. The good news, however, for a woman, so I want to differentiate, because we are talking about women who've had breast cancer. There is the larger subset of women who have this estrogen sensitive breast cancer. There are women who have triple negative breast cancer as well, right? So negative for those estrogen receptors. And, the two breast cancers behave a little bit differently. Certainly dealing with these menopausal symptoms, which is really what they are. So eventually they affect all women everywhere. The way we can handle those is a little bit different, right? The good news in all cases is that women can at least use some form of vaginal estrogen. And that's because there's no systemic absorption when you use something vaginally. And there are a whole bunch of things that you can use, a whole bunch of estrogen products that you can use vaginally that will not have that systemic absorption, where the concern is about estrogen receptors receiving estrogen at the breast tissue, right?
Right.
So that can be a sort of lifesaver from the standpoint of vaginal comfort, urinary tract issues, the incontinence issues, and in some cases the sex issues as well. The tissue, it doesn't take long for the vaginal tissue to reabsorb a little bit of estrogen. And so you can turn around those symptoms relatively quickly. And so 99% of the time, I do recommend that my patients use some form of vaginal estrogen, even if it's just for comfort. Right? Just for comfort, as opposed to having wild and crazy hanging from the ceiling kind of sex. Right.
Or you could have both.
You can definitely have both.
You sure can.
But if it makes women who've been through this feel any better, 95% of the women that I talk to, whether or not they've had breast cancer and been on HRT or off HRT or whatever, 95% of the women that I've talked to over the last 20 years complain about low libido. And honestly, it's not necessarily about the estrogen.
Yeah, I'm sure there's lots of factors for low libido.
There are.
Because if you're not sleeping, you don't want to do anything, including that.
Correct.
Right. So, you give up your hormones, like in my case, and I haven't slept much in the last couple of years because my hormones are so wonky.
And, it's an unfortunate situation. What can we do instead? There are natural compounds that can be used. There's a whole laundry list of things that can be tried. And, we see if something works. And most often I get to a place with my patient population, at least, where we find something that works for sleep. And if we don't, sometimes it's a sleep study referral. But estrogen does play a role in that sleep picture. And sometimes really it's just from the standpoint of you're having 6 hot flashes at 3 o'clock in the morning. And so that wakes you up. Right. But we can control hot flashes as well.
Well, that brings up a really interesting point because the hot flashes just kicked my butt during cancer. And with every surgery, my oncologist would say, you really need to get sleep. And I thought, well, wow, terrific idea. But I wake up every 2 hours sweating.
Yeah.
And then my mind kicks in to say, oh my gosh, what if you don't get clean margins this time? So then your mind starts rolling. So yeah, let's talk about, so there are some solutions with these hot flashes.
There are, and there are a couple things you just said that we can unpack, but let's talk about hot flashes first. So hot flashes, I mean, generally what's happening is there's a drop off in the hormones, and then there's some fluctuation. And we believe also that estrogen does affect the health of blood vessels. And so hot flashes are often a vasodilation, so an opening of vessels, and then a vasoconstriction, a closing of vessels, and then it goes again. And so when you have a vasodilation, your blood sort of runs to wherever it goes, and you can feel sensation of warmth with that. So that's called a vasomotor symptom, right, of menopause. The way I address those vasomotor symptoms, and the night sweats are, sort of corollary to that, right? You get hot and then you get sweaty.
Right. And then you get cold.
So I try and address those things in two primary different ways for my patients who've had breast cancer. One is, let's talk about the sleeping environment. There is nothing that says, A, you have to sleep with your spouse, or B, that you have to sleep under the same covers, right? I mean, the Europeans sleep with individual duvets for a reason. It's because everybody has their own temperature. There is nothing there. It is not written anywhere other than in this weird inside the box. This is the way life is supposed to be. I have to sleep with my spouse under the prettiest bedding I can buy from Garnet Hill. There's nothing that says you have to do that, right? Get your individual bedding, or it could be the blanket, or it could, whatever, or it could be separate rooms entirely because he's snoring and you can't sleep because it's too loud, or you're snoring and he can't sleep because you're too loud, right? So sleep is underrated, right? We live in a country of driving all the time, and we discount sleep. So making room for sleep, making your room your room really should just be for sleep and sex. No electronics, nothing stimulating, don't let your cat sleep on your head. Don't do any of that. Make your bed comfy, supportive, and temperature controlled the way you need it to be temperature controlled. And, if you have a hot flash, you adjust, but then you're adjusting your own microenvironment as opposed to what your partner in the bed might need. So number one, work on the environment. I probably should have said there are 3 things, but this is like 1.5. Sleep hygiene is really important. Going to bed at the same time, getting up at the same time, not spending too much time on electronics before you go to bed, right? And if you wake up in the middle of the night, don't just lie there with your brain box completely open. Get up, go read a silly magazine. You'll want to fall asleep again.
Right. And definitely not reading something on your phone, because I used to have so many clients who'd say, I wake up at 2 a.m. and I just start, reading a book on my iPad. No, read a real book.
No electronics, real book, real magazine, something like that. Listen to music. There are actually there actually are some really supportive data around what they call segmented sleep, where maybe you get 4 hours at the beginning of the night and then you're up for a couple hours. And then you go back to bed and you get another 4 hours. You're still getting a total of 8 hours of sleep within a 24-hour period. It can be as restful, as beneficial as 8 contiguous hours. So, but the hot flashes, so now hot flashes, I'm answering your question. The way I approach it is sort of multifold. I use compounds that are not going to increase estrogen levels and that affect the blood vessels more than they affect the hormones. So let me say that again. They affect the blood vessels because where is the action of that hot flash? The cause of the hot flash might be a hormonal fluctuation, but the action of the hot flash is at the blood vessel level. And so I like to use compounds that affect the blood vessels in addition to those that might be regulating that hormonal response and smoothing it out. What we often use, so a lot of my training as a naturopathic provider has been in botanical medicine, right? So using plants as medicine. And there's a whole concept of plant medicine called adaptogens. And so adaptogens are herbs that we use that can bring down a really high level of something or bring up a level of that same something. So an adaptogen is like a balancing agent. So ashwagandha, which is kind of a trendy, herb, is an example of an adrenal adaptogen. If your adrenal glands are putting out too much stress hormone, it'll bring it down. If your adrenal glands aren't mounting enough of a response, it'll bring it up. And so there are a bunch of herbs that can do that for all hormones. And so those are the two directions that I really like to work out for hot flashes. There are other methods for dealing with hot flashes. Acupuncture can be helpful, particularly something called electroacupuncture, which is putting a very mild current through the acupuncture needles, and well-trained acupuncturists can do effective electroacupuncture. There was actually a study several years ago that was a head-to-head trial, randomized clinical trial, gold standard, of electroacupuncture versus one of the predominant antidepressant drugs that is used in conventional medicine, antidepressant, anti-neuronal agent, gabapentin. And this was well-designed study comparing them. And the electroacupuncture actually did better and had longer-term results than the gabapentin.
So interesting, because I have been so desperate because of these crazy hot flashes that my surgeon, she put me on an antidepressant that she said this is going to be great for hot flashes. For me, whatever it is with my body, everything seems to work for about 2 or 3 months, and then it comes crashing down. And I had a heck of a time getting off those antidepressants. And then I did try gabapentin, and that worked for a while. So I love that there are so many options out there. But what this podcast is about today is really letting women know that there are options. And there's a couple of things I'm doing. First of all, cutting back on alcohol made a huge difference. Not that I've been a real heavy drinker, but I'd have a glass of wine a few nights a week. That, especially red wine, was killing me. So I can't do that anymore. Cutting back on carbohydrates. Sometimes I don't want to cook dinner. I just want to have a bowl of popcorn. Well, that was really, I think, just jacking up my blood sugar. And that seemed to contribute to hot flashes. But one of the products, two products I want to do a shout out. One is called Chili Sleep, and it's a mattress pad that pumps water through it. And then you can set the temperature to whatever you want. And so it just keeps my side of the bed really cold. And that's reduced my hot flashes dramatically. But then you also have a hot flash supplement that I've been taking for about 2 months now that I have really seen some changes with. So I'm happy I'm moving in the right direction with hot flashes, but it took a couple of years to get here.
I know it did. And I'm thankful that you're mentioning the product. If it's okay, I'd like to talk about it for a second.
Absolutely. Yeah. And then we'll also tag it in the show notes for people to order it.
Okay. Yeah. So I have worked in this breast cancer space for going on 20 years. And I've tried everything with my patients to help them. And one of the natural compounds that I found interestingly effective for women, and I used it, I sort of have this idea in my head of where do I want to start with someone? And if that works, great. And if that doesn't work, I'm going to go here, my own little sort of algorithm for dealing with hot flashes. And all of a sudden then that particular product disappeared from the marketplace. And so I was left, and this was probably back in 2010, I couldn't find it anymore. And that compound is called gamma oryzanol, and it's actually an oil from rice bran. It's a purified rice bran oil. And we think it affects, as I was saying, we think it affects that elasticity of the blood vessels and the health of the blood vessels. And I had found in some of my patients where I was really running out of options that the gamma oryzanol worked really well, and then I couldn't find it anywhere. Or if I found it, it was in a product that had other things in it that were of concern to me for my patient population. So I finally decided that it was going to be up to me to put together an appropriate formula for the women that I serve. I serve women with breast cancer. And so earlier this year, I started a company called Best for Breast, bioflavonoid from the inside rind of oranges and other citrus fruit. It also acts at the vessel level. Black cohosh, which is a traditional hot flash formula that is also not estrogenic, and ashwagandha, which, as I mentioned, is an adaptogen, particularly of the adrenals. So this combination I put together for my patients because nobody else had it. I'm selling it online, and all profits are going to breast cancer research. So I'm hoping that it helps people, because out of my 20 years of experience, each one of those individual things has helped different women at different times. And so together, my hope is that this can be a really great option for all women, not just women who've had ER-positive breast cancer, because I think it's a great thing.
I also know that not sleeping can impact future cancer risk and recurrence of breast cancer.
Absolutely. Yep.
Which leads me to kind of this final, big question. Why do you think 1 out of 8 women are getting diagnosed with breast cancer, and what can we do about it?
So that's a really interesting question to try and answer, right? And part of what I want to start with is that 70% of medical research dollars in the United States goes towards cancer research. So, we have an incredible vault of big brains working on this project, right? Working on the idea of cancer care, what causes cancer. If I knew, right, I'd have the Nobel Prize, but I don't. I think there are many different reasons why we have such a high incidence of cancer. I think, number one, cancer is a metabolic disease. The fact that estrogen may play a role in any aspect of breast cancer is only one tiny little piece of the puzzle. Cancer is a metabolic disease, and so there is some aspect of the environment, the internal environment of a woman's body that would be promoting breast cancer cell development. We think that has to do with blood sugar control, with inflammation, with the hormonal milieu. And that's not just estrogen, but stress hormones. And then you add environmental influence, whether it's pollution or plastics, or, we're becoming full of microplastics, which is really scary. It's really scary.
I know. Do you know Dr. Lee Aaron
I don't
Keneally?
know her, no.
She wrote The Cancer Revolution, and I interviewed her last year. And she said, we're ingesting about a credit card size a day of plastic.
Exactly. Yeah. No, I think it's all of this. I think it's so many aspects of our modern life. Particularly in the United States, we have a crappy diet. Standard American diet is a crappy diet, and that's what the majority of people are eating. We're nutrient deficient from the get-go. In the Pacific Northwest, the rate is actually higher. It's more like a 1 in 4 incidence of breast cancer in the Pacific Northwest.
What?
I think it has to do with vitamin D. And there's starting to be some studies about that. But here in the Pacific Northwest, we don't get enough vitamin D production naturally, right? So, but I think the other piece that we're going to learn a lot more about over the next 20 years, really, is we are just on the brink of understanding genetics and cancer, right? And the genes that are tested for, with the color test, with Oncotype DX, or any of the tests that might be done when a woman is diagnosed with breast cancer, those genes have been shown to be oncogenes, which if they are switched on, they will cause cancer, right? So that's a particular class of genes, these oncogenes. This gene equals cancer. But what we're really on the brink of, I think, is understanding the rest of our genetic makeup when it comes to things like detoxifying from all this stuff that's coming in, either from our food or from the environment or wherever, and detoxifying our own hormones, right? So there are a lot of genes that I think indirectly will be determined to be players in cancer development because, for example, maybe you just don't metabolize your estrogen well. And so it sits around in your system longer than it should. Right? But that has to do with liver detoxification. It has nothing to do with BRCA1 or BRCA2, right? So all of that.
Okay, so I said that was my last question, but now this is my super last question. To play devil's advocate here, isn't there just more money for big pharma in treatment than cure?
Yes, I think there is. Yes and no. I mean, that's a really hard question to answer. Anything related to big pharma has big money. And I think that the best we can do, it's very hard to go up against big money, right? It's very hard to go up against big money. It's very hard to go up against big institutions. It's very hard to go up against small institutions. But I think the best thing that we can do as individuals is learn how to critically think about research data, right? Learn how to evaluate the data in front of you, as opposed to listening to various people in your circle. I think, becoming critical thinkers is really the way out of our mess in lots of different ways. So.
Couldn't agree more. And I will add, listen to that inner voice. And if if that inner voice is saying, don't do this treatment or do that treatment, or, give that some credence. It's there for a reason.
Well, and I think also, and this is one other thing I want to mention, the other thing I've been spending an enormous amount of time on this year is I've been trying to basically write a living book. I've been putting together a 4-week intensive online program for women who've just been diagnosed with breast cancer to help them make really informed decisions about their care and whether or not an integrative model is the right thing for them. And a big piece of that is building your own team with people that you trust. And standard of care treatment for breast cancer is going to be relatively the same, regardless of whether or not you go to the great big fancy university hospital down the road or the tiny little podunk hospital farther down the road. If you find a medical oncologist, a surgeon, a radiation oncologist, if you find those people and you like them and they answer your questions and they treat you with respect and listen to your concerns, those are the people you want on your team. And there's nothing, just like not sleeping under the same blanket with your spouse, there is nothing that says you have to go with the team they give you. You can advocate for the team that you want.
Love that. I love that so much. And I can relate because I actually ended up firing one of my oncologists because they just did not want me to question any of the treatment. And when I asked questions, they were not respectful. And so I asked for somebody else, and I got somebody else, and I got the answers. Maybe I didn't want to hear the answers, but we had a respectful conversation, and that's really important in every season of your life, but certainly cancer.
Well, and I think there's so much dehumanization that happens in the breast cancer process. I mean, so many women are having their breasts taken off. And if that isn't a dehumanizing experience, I don't know what is. And to have the people around you, cancer is a full-time job once you get it. So you want to like your coworkers, right? Having the right medical oncologist, all of these different people that you need to have, it's so important to be able to empower yourself because it is your body, it is your life, it is your consent, right? You have to consent to every stage of the game. But you want to consent knowing what your risks and benefits are. And so that's where we get back to understand your diagnosis and understand what your options are. That's what I try and help women do, is understand it and make really good informed decisions. And, conventional cancer care and naturopathic care, integrative care, none of us have the answers.
Oh, Dr. Laura James, thank you so much for coming on my podcast today.
Thank you for inviting me.
I love my cell phone. I love my AirPods, I admit it. But what I don't love is the radiation and electromagnetic frequencies that are coming out of both of those things. So all of a sudden, I got this ad on Instagram about this product called WaveBlock. Honestly, it seemed too good to be true. So I called the owner. His name is Ben, and we had an amazing conversation about this product he created basically to protect his kids from EMFs that were coming out of cell phones and headphones and you name it. He explained the whole process to me, how he took it to Europe to get it tested, and how it really can block the EMFs that are coming out of our devices. So I've got a great coupon code for all of our listeners today. Go to the WaveBlock website. It's in today's show notes. Use the code ENOS20, and you can get 20% off of his products. Two of the products that I'm currently using are his wraparound WaveBlock for my AirPods, and then I also just got a new cell phone, and he has a sticker that can go on the back of the cell phone that is also going to help to knock down the EMFs. It just gives me a little bit more comfort, I think, with using these items. Go to today's show notes to get your 20% off coupon for WaveBlock. Thank you for joining me today on the Why Did I Get Cancer podcast. I've got my shopping guide for all of my cancer self-care items in the show notes, along with information about today's guest and our show sponsors. And don't forget to subscribe to my podcast so you never miss an episode. Keep in mind, I'm not a doctor. I'm just a gal that got diagnosed with cancer and wanted answers. If you need medical advice, please be sure to consult with a medical professional. And thank you for listening.